Welcome to the front line, where we'll discuss this COVID crisis. I'm Carol.
I'm Bryn.
We are third-year emergency medicine residents in California.
Like most emergency medicine programs, we rotate at multiple sites. We practice in an academic center, county hospital, and then community hospital to make sure that we get a wide breadth of training.
We had actually planned to start a video series. We were going to call it Emergency in the Kitchen. We were going to be cooking together and talking about being an emergency medicine resident, practicing medicine in general, what that's like.
Hi, I'm Bryn,
I'm Carol.
and this is Emergency in the Kitchen. Woo! It's ironic because we tried really hard. We got all the setups, and we got all the cameras, and we got all the lighting, and we were like, we really want people to know what it's like to be a resident in this world, because all you see are things like scrubs and house and the resident. We wanted to show what it was really like to be a resident.
So we never actually, we filmed like one episode and then it was like kind of dead from there. We started noticing that topics about coronavirus are popping up in our emails from our facilities. Also, like, we're talking about it a lot more on shift and actually screening for it in the hospital. And so kind of wanted to be able to document our experience of what it's like dealing with this on a day-to-day basis and how the healthcare system is reacting to all of this.
Almost to give you some insights of a resident experience on the front lines, as it were.
All right, let's talk about coronavirus as a class. Coronavirus is actually a class of viruses. It's a whole group of viruses, and it causes diseases in both mammals and birds.
In humans, coronaviruses can cause most commonly respiratory tract infections and range from mild to severe. In our history and your memory, the most severe of which are going to be SARS and MERS. SARS is going to be severe acute respiratory syndrome, and MERS is going to be the Middle East respiratory syndrome.
Just to emphasize, like, we see coronaviruses all the time.
Every day.
Mostly in our pediatric world, like when we see kids, there are different coronaviruses that are more prevalent in the summer versus the winter. So we are definitely seeing coronaviruses throughout the year. Most typically they cause like what you would consider like virally type symptoms, which are headaches, body aches, runny nose, sore throat.
But the ones that seem to be the most dangerous are the ones that I just listed off because they have genetically mutated. So most of them seem to have started off in bats and then for some reason are able to mutate, spread to a cat, a camel, and then they infect their first human, and then boom, you get the spread and the exposure and the dangerous respiratory illnesses that are in our history books.
To be clear, they're viruses, so they're not actually living entities. They require a host to replicate, and for you science nerds out there, they replicate using RNA. That's about as sciencey as we'll get.
The basics. What you need to know is that this spreads through respiratory means, most often what we call droplet, meaning that if people are coughing or breathing on you or rubbing snot on you like little children do, that all counts.
And there is data that it does survive on surfaces, just like other viruses, on like door handles, on different household items that like you touch very frequently and things like that, especially if you're like wiping your nose and then touching those areas.
This is why washing your hands is so important.
Wash your hands. Wash your hands.
Honestly, we're just as confused as a lot of people because we're getting about 20 emails a day and things are constantly changing. The criteria, what we're supposed to look for, what we're supposed to wear, who we're supposed to screen, what we're supposed to be doing. It gets very confusing.
It's just weird because I feel like we're hearing like one thing from like the medical community and then we're hearing another thing from the media, and the media is like totally freaking out. Like, people are going out and buying all the toilet paper and all the hand sanitizer and all the water as if like those are the things that are going to be like, it's going to like that's going to be what's going to save them in this. I don't know, like I don't really sense that amount of panic. So I think we're going to be chronicling kind of our experience and what we're seeing on a day-to-day basis, hopefully to try and get a word out there about what's truly going on, hopefully debunk some of this stuff that's going on in the media that might not be completely accurate.
But also to give you insight as to what it's actually like to be a physician in these roles where we're going to be exposed potentially to a lot of these patients. We don't know quite yet what that experience is like for us, how we're feeling, and what it's like to be on the front lines in emergency medicine.
I mean, we literally are, we're kind of like everyone's safety blanket.
We're always there 24/7. We always have shifts. We never turn anyone away. There's literally laws that will not allow us to turn anyone away. When other clinics aren't open, when specialists are not available, we are always there.
And that is very much some of the reasons that both of us chose this specialty. There's a lot of burden on that. There's a lot of thought that goes into that, how that affects our day-to-day lives, how that affects our families, how that affects
how we interact with the populations in general. So we have yet to experience how this is going to go, so we're going to be keeping track, checking in regularly.
Please leave us questions down below. Anything you can think of, any questions, any myths you want us to debunk, we're happy to answer as accurately as we can, given the information. As you guys know, it's an iterative process, as we said before, so things are always changing every single day. Like and subscribe to get more from the front line.
Bye.
Bye.